Hi, I'm Dr. Victoria May, a plastic surgeon in Scottsdale, Arizona. I wanted to chat with you a little bit about visceral fat. It's a question I get from some patients, and how is that different from other kinds of fat? So we have visceral fat on one hand, and then we have subcutaneous fat. So subcutaneous fat is really just the fat that's found sub or below the cutis, which is the skin. So skin, fat, and then usually muscle. So it's fat that you can actually usually pinch between your fingertips, especially on your tummy area, whereas visceral fat refers to the fat inside your abdomen around your organs. So the viscera is just your organs, so intestine, stomach, liver, etc., things like that. We can't access it with typical surgery, so we're not going to remove it, not accessible with liposuction, anything like that. So if you have a lot of visceral fat, it's not going to change if you have liposuction. That's one important thing to think about. Number two, visceral fat is important for a couple reasons. It's really associated with a lot of diseases, including like diabetes and metabolic disorders, obesity, hormone changes, etc. And it also has a lot of immune function. So it has some really positive aspects to it, and it has some kind of negative aspects to it as well. The thing about visceral fat is it really can only be changed with diet, exercise, and these new modern GLP-1 drugs. So when you're thinking about having a body contouring procedure, it's important to realize what kind of fat we can remove and what kinds we can't. And so hopefully it gives you a little bit of guidance on what visceral fat is. You can kind of do a little pinch test on yourself and kind of assess that. And of course, when I see you in consultation, we'll talk about that as well.